This is my notes and I have to condense all this into a super notes which I can read in last 10 days. This is exact query which I'm getting in my DM nowadays. So today in this video, we'll be discussing how to concise notes so that you can revise in your last 10 days. For this, I'll be using my surgery notes which I used for my preparation during 2022 NEET PG. And I'll exactly tell you how to concise this 561 pages into a revisable source in 4 days. Is it possible? Let's see. See, these are the content which are available in surgery notes, main edition. This was basically edition number 4. Okay, so marrow edition 4, which I used during 2020, 2021, and even for my NEET PG in 2022. I have been NEET PG strategist for past 2.5 years, and I have talked to 5,000 plus students over my online consultations, and I have made many strategies. So this has been a popular query in my DMs. So this is the whole content which we have currently, and we have students, and I want to read all these 561 pages in 4 days. So what will be my strategy? So first is there is something known as yielding index, which means all these 63 topics which are contained in this 561 pages are not important. They have a priority basis, which means some topics reading for 1 hour will yield more output when compared to rest of the topics. And we'll see exactly what this is. So at the end of this step 1, you should be able to divide a topic into very high yield topics, moderately yielding topics in yellow, and low yield topics in green. So this is exactly what you require to conduct this analysis, and thankfully I have made it for you. This entire analysis of all 19 subjects for NEET PG is available in my Telegram group, Dr. RMD NEET PG INICET Guidance group, for free. Link of the Telegram group is in the comment section. So go to the Telegram group and download these images. So for surgery, if you note, if you see PYQs, this is the division. That is the most high yield topic are from general surgery, from upper GIT, and third from urology, where 13% are asked. But you should also note that there are smaller topics like thoracic and vascular surgery, basically vascular surgery, from where even though the content is very less, but still 9% of the questions are being asked. Similarly from trauma, where number of questions are less, but the content to study is also less. From breast also, every year one or other question keeps on asking, it's being asked. When you compare this with endocrine and lower GIT, if you see the topic that is there for endocrine and lower GIT, it's huge. But still number of questions that are asked are comparatively less to this. So first step is to know this yielding index. So this yielding index is basically your weightage percentage. So go to the Telegram group and kindly download these images. Now, once you have got this, once you have got this yielding index, now you can effectively rule out some of the topics which are not required for you to revise. And examples for those topics are, one is specialty surgery, bariatric surgery, minimal invasive. From these, even if you study, it's not of much, it doesn't yield much output, okay? So you can straightforward exclude this. So we are going to exclude specialty surgery, we are going to exclude facial-maxillary surgery, we are going to exclude spleen, thorax, and mediastinum, because these get covered in other topics also. So straight away, from 561 pages, we have effectively decreased some of the pages, at least around 50 to 60 pages with this approach. Now, you have done triage at first step. Now, what is this second triage? So triage within a triage, okay, this is the second step. So basically, you know that general surgery is a very important topic, but the problem with general surgery, there are like 10 topics in general surgery. So now you need to effectively prioritize topics within this topics, okay? So patient safety, OT zone, and surgical checklist. What is the use of it? Like hardly you might get one question out of like on a full moon day, okay? So this definitely is not the taller topic that you should be wasting time on. Causes of post-op fever. It will hardly take you 1 minute to just go through important post-op fever causes, so not required. Third is wounds. You already will be studying wounds under pathology, so it's a repetition topic. Shock. Again, you'll study in medicine, you'll study in pathology, you'll study in pediatrics, so no point in studying in surgery. So 4 topics we have effectively excluded from just general surgery, okay? So what it will do is, basically in this triaging within triage, you will remove topics from within a topic which are less important, and second is those which are repetitions. So you won't be wasting time on these things. So I have removed all those topics. Let's say from gastrointestinal tract, esophagus is very less asked. There are only 1 or 2 questions which are frequently asked. One is esophageal cancer is not asked that much. One is GERD which is asked. Second is esophageal manometry and achalasia cardia. Those questions, only 2 type of questions are asked frequently. Next, pancreatic condition. Only pancreatitis is asked. Other than that, adenocarcinoma of pancreas. These are the only 2 questions which are asked. So you don't have to study whole chapter for that. These similarly lymphatic system, hardly 1 or 2 questions here and there, so you don't have to go through it. So effectively, after removing all these topics, we have converted our 561 pages notes into 413 pages. Congratulations. You have effectively eliminated around 150 pages without even going through revision. So this is what is known as prioritization, triaging, and this is exactly what is required when you concise notes. We are not done yet. We'll be going to the next step, that is step 3. So one question which is there in your mind says, what if there is some important topic within these topics which we have just excluded, correct? So what is exactly the most important topic? They are PYQs. So if you go into Marrow or any other platform, I have used Marrow because I have used Marrow example, Marrow notes. So here this is the list of topics which are given under Marrow PYQs, okay, which are PYQ topics, okay. So now your job is, it will hardly take you, see, if you go through last 5 years NEET PG papers, it will hardly take you 10 minutes or maybe some 5 to 10 minutes to mark these topics in your notes. So basically aortic dissection under arterial disorders, I'll just make sure that I'll highlight that specific topic, okay. So I'll highlight that topic in my notes. Similarly, berry aneurysm and SAH under trauma, I'll just mark it. Similarly, breast carcinoma, immunohistochemistry only I'll go and mark it, because I'll tell you what is the use of this. Similarly, I'll mark all these topics which were asked for 2023 NEET. Similarly, I'll do this for last 5 years NEET PG, last 2 years ICT and last 2 years FMG. So it will take me around 1 to 2 hours, but this is going to be very useful, extremely useful, because let's say even after condensing everything, you're not able to revise in last 10 days, you will be just going through these highlighted topic of your notes. You don't have to study this now. You first highlight it. I'll tell you what is the next step. So you have highlighted everything and kept. So now, what's your next step? Your next step is being Sherlock Holmes. Now, what is being Sherlock Holmes? There's a famous dialogue by Sherlock Holmes that you see, but you don't observe, which means that you actually go through your notes, but you don't observe that coaching platforms have already made it easy for you. I'm not advocating for Marrow and anyone. I used Marrow notes, surgery notes for my final year and during my internship to prepare, and hence I am using this as a source on how to concise, okay. So if you note this, see, this is the pages from trauma, okay. So here you see, already circulatory causes are mentioned, which means this is important. Golden hour of sepsis is mentioned, that is 1 hour after trauma. And platinum minutes is first 10 minutes after trauma. Most common cause of immediate cause of death after trauma is head injury. So if you ask me, in this one page, how much time will it take for you to finish? You might tell it will take at least 2 minutes or 3 minutes because you have to go through each and every word. But for me, it took only 10 seconds. Why? Because Marrow has made it easy for me. I have to just go through 1 point, 2nd point, 3rd point, 4th point. That's it. I'm going to the next page. Like I'm going to splenic injury, for example. Fracture of 9th to 11th rib, I saw it, yes. I saw what is care sign, enough for me. Next, I'll go through this simplified version of splenic injury scale, which will take some time, but I have already highlighted it. So laceration less than 1%, less than 10% subcapsular. These 3 are the key points. Next, 1 centimeter, 1 to 3 centimeter, more than 3 centimeter. That is done for me. I don't have to go again. And then more than 25% of the spleen is involved with, and last is complete devascularization. Done. It will take hardly 1 minute to memorize everything because Marrow has made it easy for me. Similarly, pneumothorax, see, most common, what is the cause? Second is sucking in chest wall, cause if it is more than 2/3 of the circumference, it will cause open pneumothorax. One-way valve is formed, it will cause tension pneumothorax. What are the clinical features? I have to just go through 4 points. So you see, right? You don't need you don't need more than 2-3 minutes to revise entire page. Each coaching platform has made it specific so that they have highlighted in your notes. But the thing is, you don't observe. You just see it and you forget it. You will be just trying to memorize everything because everything is important. Everything is important. No, everything is done for you, but you just don't observe it. Similarly, this is rapid revision notes of Marrow under pediatrics. So if you ask me what will I see in this, my first thing will be like first clinical manifestation. I have 3 C's done. Next, I have Koplik spots. I know what Koplik spots are. I don't want to read again. Day 4 maculopapular rash, done. Next, on day 8 they disappear with brownish pigmentation, done. Next, I will go just to chronic complication is SSP. Most common acute complication is otitis media, and in SSP we get myoclonic seizure. Done. I don't want more than this. This is more than high yield information that coaching platform has given me. That is more than enough for me, and this will hardly take me 1 minute, not more than 1 minute. This is how you revise. This is how you concise. So what is the next step? Step 5. Now you know what to read. You have concised your notes to 413 pages. You have also marked what is high yield in each notes by going through previous year topics and highlighting them, which hardly took you about 1 hour, not more than that. In the beginning only you do that, okay? And now what is most important step, that is mapping. Now what is mapping? Not all topics are important, you know by now, okay? So you have to complete 413 pages in 3 days. So how will you do it? Okay. So first thing is, you will see how much time is left. Let's say you are studying for 7 hours per day, okay? That is idealistic. I don't recommend reading like more than 10 hours per day. You can't actually. Idealistic or realistic is 7 hours per day. That means if you sit for 3 days for 7 hours with this surgery notes, so this is just part 1, okay? Part 2 is inside. I have not even opened it. So it will take you total how many days? For 3 days, it will take you 21 hours, okay? So 21 hours we have total time. Now in this 21 hours, what we'll be doing is 1 hour, how much time you will require? You will require around 20 pages. That means 1 page you will complete in 3 minutes. This is known as time constraint based studying. So your constraint is time constraint based studying. Now tell me, from these pages, will you require 3 minutes? I would say definitely not. I can just complete it within 1 minute also, because everything is there. You are just revising things, okay? You're just revising and you're trying to remember these things. So next important thing is how to set timer. Now you will say, "Sir, I can't go from like one page. It will take me 5 minutes. I will be sitting in that page thinking everything." Okay, now what is the solution to this? There is something known as interval timer app in Play Store. See, I'm not promoting this app, but this is a very useful app which I have also used for my MD exams. So here you can keep sets, okay? So every 5 minutes it will give an alarm, it will give a reminder that you should go to next page. So let's say you're on this page, yes, this page. At the end of 3 minutes, it will give a reminder. So you will be forced to go to the next page. So what will happen is, in 1 hour, you will definitely cover 20 pages, okay? Yes, next thing is mapping. Mapping means how to go through within those topics. Like if I give you this topics and I tell you, complete this within 7 hours, so you know the time constraint. You know that each page you should give 3 minutes. 3 minutes for one page. But will you give equal 3 minutes for all page? No, you won't. You won't. You will never give equal time to all page, because you know that some pages have more information which are high yield. Some pages have less information which you can complete quickly. So what you will do? See, these are the topics what is known as mapping. You will use a red and green marker. Red are the topics which are very important, like thyroid is frequently asked. So those topics you will definitely give 3 minutes. And these topics like adrenal and neuroendocrine tumor, you will try to finish within 3 hours, in less than 3 minutes, within 3 minutes, in less than 3 minutes per page. Similarly, upper GI stomach is very important. So this you will give up to 3 minutes if it is required. But intestinal obstruction, these topics you will give less time. Also, topics I have marked in blue, like small and large bowel benign conditions, liver 1 and 2. So from these topics, very less questions are asked. So these topics will keep at last. You will not study in the beginning. So I will go first with these topics which are marked in red. Then I'll go with topics which are marked in green. And then last, if I get time, I'll go through topics marked in blue. Whenever I'm going through all these topics, let's say, let me go back. Yes, let's say pneumothorax. Pneumothorax is a very important previous year question which is asked almost every year. So when I'm reading this, I'll make sure that I read each and every word of this properly so that I don't commit any mistake. Because initially when I told you step 3, what was your step 3? Step 3 was marking these things. No, in this pneumothorax will come. So I'll mark it as a separate star bookmark, very important. So I'll make sure that whichever is star bookmark, whichever is marked in star or separate highlighter, because it's a PYQ, I'll go through that properly. Now you will tell me, what about those topics? There were topics like esophagus, where I have completely left it out. There were topics like wound, which I completely left out. There were topics like mediastinum, which I completely left out. Now you should understand, those topics are not worth your time. So what you should do, you should get high yield topic from only those specific topics, right? Correct? So what I will do is, I will make a custom module on the 4th day. I told you, in 21 days, I have completed all these topics. Everything is done. Sorry, in 21 hours, in 3 days. On 4th day, what I will do? I'll do custom modules. Custom modules, I'll select those specific topics which I had striked out. You remember, right? In black, I had striked some topics. Those I'll put in custom modules. And then I will add hashtag PYQ in them. And I'll add hashtag of clinical in them. Okay. And I will set easy to moderate difficulty. And I'll do around 50 questions from all these topics. So now I know what is there, what is important in those topics. And I know what majority of students have answered it properly, so correctly. So that means I have a set of high yield questions. And I will just dedicate some 2 to 3 hours for that. And I won't take much time out of it. So D-Day means that is the 4th day. So if you have total 4 days to complete surgery, 3 days you took time to revise these notes with this scientific method which I told just now, with using 6 steps. 7th step was basically compensation, that is on D-Day. D-Day you will be doing, one is you will do that skip to topics custom modules. You will also make sure that all PYQs that you have marked in your notes, okay, which I told you in step 3, all those are being done. And last you will do is, you will highlight those PYQs also. And last one more step that you will do is, you will make sure that each chapter, if you get extra time, each chapter, write down all important points in a small sticky notes. All important points in a small sticky notes and paste it on that specific chapter. For example, let's say this is pathology, this is breast, okay. We are going through breast chapter, okay. So whatever important topics you have, okay, in everything, whatever important topics you have, okay, just select these many topics which you can write it in a sticky notes, not more than that, okay. It should be not more than 10 lines, okay, maximum 10 lines. So just write it here in first page, make a sticky notes and write it here, these 10 points to write it, okay. So that in last 10 days, whenever you are revising, you can just revise these 10 points because those are very high yield points. So you can reach out to me if you have any doubts. If you need any mentoring sessions also, they are also available. You can also book one-to-one consultation. All link will be provided in the pinned comment section. And in next episode of the following discussion, next part of the video, we'll be discussing how to bulk up notes, what to add to your rapid revision notes, what to add to your BTR notes, what to add and what not to add, and how to make a consolidated revision source. We'll be going through it in the next video. So if you haven't subscribed me, just make sure that you have subscribed me and click on that bell icon so that when the next video is uploaded, you are notified of on that and you won't be missing that topic. Okay. So all the best.